Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim Mustafa. This is Health is Wealth, only on Jamia TV. This week, we talk about headache. Remember, headaches are so common that many people ignore them, dismissing the pain as stress, fatigue, or just long day. Yet globally, nearly 1 in 2 adults experience headache every year, making it one of the most widespread health condition affecting humanity. But when does a simple headache become warning sign? In our show today, we'll discuss about what headache really mean, causes of headache, diagnosis of headache, and the possible solution for headache. To help me in this will be Mustafa Afe, a final year student from the University of Nairobi. And Mustafa, salamu alaikum, karibu sana ndugu yangu.
Wa alaikum salam wa rahmatullahi. Thank you for having me, Kasim.
Now.
And thank you to Jamia TV for extending the invitation. Okay. And it's a pleasure to be here.
Karibu sana.
Thank you.
Sasa wewe ndo my namesake.
Yes.
Since I started this program, I've never met a namesake, and alhamdulillah, yeah. I've met a namesake.
Yes, finally.
So I've already introduced you as a final year medical student. Maybe will you kindly tell us your interest as a medical student?
Yeah, so currently I'm now in my final year of medical school. Okay. So it's usually a 6-year program of undergraduate medical school.
Yes.
And then once you graduate, you can decide whether to specialize or just remain as a general practitioner or an AMO.
Okay.
Yeah.
So today we are talking about headache. It's a very wide topic. Someone told me if we choose to talk about headache, we can talk about headache the whole day, but we cannot finish talking about it. So maybe you tell us what exactly headache in a medical perspective.
Okay, yeah, you're quite right. So it's quite a vast topic, and by definition, the International Society of Headaches, they came up with a standard definition, and they defined it as a facial pain or pain in the cranial region or neck that is just an uncomfortable sensation to most patients.
Okay.
Yeah. So they came up with this standard definition, and they refrained from using the word pain because pain can be a subjective symptom. You know, what's painful to you cannot necessarily be painful to me or another guy.
All right. Now it's the right time we talk about categories and different types of headaches.
Yes. So we can classify headaches into 2 main categories.
Okay.
So we can look at it first. Is it a symptom or is it a disease?
Okay.
So when we say symptom, we mean that there's an underlying cause or an underlying systemic illness somewhere that is manifesting as a headache. And then when we can say it's a disease is if it's a primary headache.
Okay.
So the 2 main classifications used are primary headaches and secondary headaches.
Okay.
So a primary headache will be a headache with no identifiable structural pathology. So that's when you can say this headache is a disease. And the major ones are migraine headaches, there's tension headaches, and there's also cluster headaches.
You've talked about migraines,
yep.
Tension. I want to understand the difference between tension, headaches, migraines, and cluster.
Yeah, so these 3 main headaches are part of what we have said primary headaches.
Okay.
Yeah, so what happens is the character of the pain is what manifests differently in these conditions. So for example, your migraine headache, patients will tell you that they're complaining of a unilateral sided headache. So it can be on one side of the face, and they usually say it's throbbing in nature.
Okay.
Yeah, and migraine headaches are usually also associated with nausea and vomiting at times, yes.
Okay.
The tension headaches now patients will tell you that they feel like there's a band-like compression at the front of the head.
Okay.
So, and it commonly affects male population. The migraine is commonly seen in females. And then the last one now is cluster headaches.
Yes.
So patients will tell you that they have this unilateral sided pain, either on the left or right side, and they feel like it's though it's a stabbing nature, stabbing in nature, yeah. And this pain is usually associated with symptoms like sweating. Some of them can have tears, and then there's also nasal discharge in cluster headaches. Yeah.
So me, I want to understand, why will someone having headache feeling pain on the head, on the different parts of the body of the head, but the brain doesn't feel the pain? Why?
Yeah, so it's a common misconception among most patients. They tell you, Daktari, I'm having headaches, so is my brain okay? They're usually very worried. They think maybe the pain is coming from the brain. So, but this is not necessarily the case, because the brain itself is, it lacks free nerve endings, the brain cortex. It lacks free nerve endings. However, there is, it's surrounded by structures that are richly innervated. So when there's inflammation or a disease process of some kind, the nerve endings that are surrounding this brain, like the blood vessels, nerves around the brain, are what now bring about this pain. So they usually come to tell you, Doctor, is my brain okay? So it's usually a common misconception that the pain is coming from the brain. No, it's not.
And what are the most common causes of headaches?
So you can have, so the way I just told you, divide it into the primary, secondary headaches, and then there's the common headaches of everyday life. So that is what most patients will present with. So otherwise healthy individual, normal person, they go about their day, they wake up in the morning, they're fine, they go about their day, and then they present to you with headache. So most of the time, usually what causes this is physiological imbalances in the body. So common triggers will be things like lack of adequate sleep, poor dietary intake, or hypoglycemia during the day. Dehydration is also a common factor that causes the headaches of everyday life. So those are the common triggers for headaches of everyday life.
Someone somewhere is asking, dehydration in which way? Because they may not have encountered the word dehydration. So maybe you help them understand what dehydration means and how dehydration may result to headache.
Yeah, so dehydration is just basically your fluid levels in the body are not adequate. So what happens is, our body, the normal physiology of the body and the homeostatic balance, once you get dehydration, it alters this normal physiology. So now it reduces the threshold for developing headaches. So most patients, you just tell them, they'll tell you, Daktari, in the evening or when it's too hot, I start having headaches. And then you just tell them, just try and hydrate more. And they tell you, actually, Daktari, the pain has gone away.
Now you've talked about when it's too hot, they feel a headache, they feel pain. We have those people who are used to mobile phone, eye strain, screens, light. How does screen, light, and mobile phones maybe cause headache? Can it cause headache in the first place?
Yes, so most of the times the screen brightness and prolonged use. So it's under something called eye strain related headaches. So you'll find especially teenagers or young adolescents, they come from school and they are on their half-term break or during the holidays, and the whole day, they just spend scrolling or on the TVs. So they come and then they tell you that they're having this headache. So it's usually mainly because of eye strain and increased brightness, prolonged usage of the screens. So they just cause you eye strain, and then you get eye strain related headaches. So most of the time it's just self-limiting. You just tell them to standardize the use of screens, protect their eyes, and even some of these devices, they come with now a true tone effect.
Okay.
So just turn it on and it reduces the brightness and adjusts to the surrounding.
All right.
Yes.
Some of us, mtu akilalia pilo, akiamka asubuhi anaumwa na kichwa, or akikosa kulala na pilo, akiamka asubuhi kichwa inamuuma. Is there any connection between the posture and the headache?
Yes, there is. So usually what happens is when you sleep, sometimes people can sleep, maybe they use a hard pillow, or they just use maybe the position of sleeping is a bit different, and they develop neck strain.
Okay.
So, you know, sometimes this neck strain can present as a headache in a patient, just because of the surrounding nerves that are being compressed by the neck strain and the muscles around the area.
Okay.
Yeah.
Can hormones change or contribute to headache?
Yes, they can. This is commonly seen in women of reproductive age. So there is something called premenstrual syndrome. It's one of the manifestations of this syndrome is usually headaches.
Okay.
Yeah, so most of the time there's hormonal fluctuations during menstruation period, the menstrual cycle in women.
Okay.
And so these hormonal fluctuations now cause decreased CNS sensitivity. So the central nervous system, the sensitivity is a bit decreased.
Okay.
So common now, it can trigger a headache. That's why most of the women you'll find they have migraine headaches.
Okay.
Or those who with a known diagnosis of migraine headaches, they can present with attacks during this period because of the hormonal fluctuations in the body.
Okay.
Yeah.
Is there any generic or hereditary headache?
What we can say is there is a strong familial association between some primary headaches and development of these headaches in patients. So common is migraines.
Okay.
So you'll find patients with migraines, they tell you, you take a history from them, and they tell you, you know, my aunt used to have this, my mom has this, my sister has this. So you find that there's this common association, familial history in primary headaches like migraines.
Okay.
But secondary headaches, you know, these are headaches that are caused because of another illness, maybe an infection or a malignancy somewhere in the body. So those ones are not familially oriented or genetically predisposed. Okay. So it's just the primary headaches like migraines, sometimes even the tension and the cluster headaches.
What is a red flag in headache? When is headache considered very dangerous?
Yeah, so this is now where most patients, they want to know, because, you know, most people get headaches in their lifetime, and nothing really happens. They just maybe rest or take maybe a painkiller and they're fine. Yes. But there are certain red flags for headaches. We call them red flags in medicine for headaches. Okay. And there's a mnemonic we use, we call it SNOOP-T. Okay. SNOOP-T. Okay. So the S will stand for if you're having a headache and you're having systemic features. Okay. So you're having a headache and then you have a fever, or you have a headache and there's weight loss. Okay. So this can be it's probably an infection somewhere in the brain, maybe meningitis, or you're having weight loss now. It can mean maybe there's a malignancy somewhere in the body. Okay. Yeah. And then the N stands for neurologic deficits. So you're having this headache, and then you're having left-sided weakness of the body or right-sided weakness of the body. So this means, now this is more serious because it can mean maybe there is a stroke somewhere, or there is a compression in the brain. And then O, the first O is for onset. So some patients, they'll tell you, Daktari, this is the worst headache of my life. So we call that in medicine something called a thunderclap headache. So it's usually indicative of subarachnoid hemorrhage, meaning bleeding inside the brain. So, and this is a neurological emergency. Okay. Yeah. Then the other O is for old age. So if you're having a patient is coming to you and they're telling you, I'm having this new onset headaches, and they are 50 years and above. Yeah, that warrants further neurological assessment. Yes, and then the P will be for positional change. So some patients will tell you, when I move my head to the side like this, or I go like this, or I do this, my headache worsens. So this is usually, it's also something that's quite serious, because it can mean that there's increased intracranial pressure in the head. So that also needs emergency evaluation. And then the T finally is for trauma.
Trauma, yes.
Yeah. So patient will come to you, maybe they've been involved in a road traffic accident and they hit their head on the car or something, or some have been assaulted, maybe by thieves, and they've received a blow on the head. So, and they're telling you that they have headaches. So this is quite serious, because they can mean maybe we're bleeding inside the brain as well.
Okay.
Yeah.
So you've talked about Snoop T.
Snoop T, yes.
Yeah, Snoop T. You highlighted the systematic symptoms.
Yes.
That is for S. You highlighted N, the neurological deficits.
Yeah.
You talked about the double O. That is O, the onset, and the other O for older age. Then P, position, and then T for trauma. I think our viewers back at home have learned something. What are some of these things that might lead someone to seek medical attention immediately? Once you feel that sign, you need medical attention immediately.
Yeah, so if you're having a headache and you have an associated fever, high fever,
yes,
and you're having neck stiffness.
Okay.
So this can mean maybe you're having meningitis, for example.
Okay.
So that's also an emergency.
So neck stiffness,
yes.
ndo shingo inakuwa ngumu.
Yeah. So a patient is telling you, I can't move. It's difficult to move my neck.
Okay.
So the neck is stiff. Yes, and then another case is you're having a headache and the patient is telling you this is the worst headache of his life. Yeah? So the thunderclap headache that I just alluded to. Yes, and then the other one is you're having systemic features. So you're having a weight loss. Okay. Yeah, so this can mean maybe the headache is because of a malignancy somewhere in the body and it requires thorough evaluation. Yeah.
Talk about tumors and traumas. Okay. As the key factors that might lead to someone to seek immediate medical attention.
Yeah, so I'll start with trauma, because trauma, is just quite straightforward. You receive a blow in the head, or you're involved in an accident somewhere, and most of the time trauma headaches are usually just sudden and acute. So acute meaning this patient will present almost immediately. Okay. After the event has happened. Yeah. Then for tumors, some tumors are slow growing. Most tumors actually are slow growing. So you'll find a patient is telling you, I've been having these chronic headaches. So I've been having headaches 6 months, 7 months, 1 year, 2 year headaches that are not responding to medication. And you ask them, so during this period, have you noticed any changes in weight? And some tell you, I have not really been weighing myself, but I can notice that my clothes are a bit loose fitting now, and I don't need to wear a belt anymore, things like that. So this is likely indicative of a tumor headache, for example, and requires now further assessment by a health professional.
Inshallah. Thank you so much, Dr. I want us to take a very, very, very short break. Okay. Ladies and gentlemen, we're talking about headache, a very common illness affecting very many people back at home. Remember, we are here to give you the solution for your problems and your health issues. Inshallah, keep tuning Jamia TV. We'll be right back after a short while. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim Mustafa, and this is the second segment of Health is Wealth. We are talking about headache, a very serious and common illness affecting millions, if not hundreds or thousands of people across the globe. And in studio, I'm with Mustafa Afe, a medical student, a final medical student, or a final year medical student from the University of Nairobi. Remember, we talked about the causes of headaches. We also understood what headache really means. And you might have been experiencing a lot of signs and symptoms of headaches. And remember, we've talked about it in the first part of the show. So I'll ask Mustafa to tell us how doctors diagnose headaches. And Mustafa, karibu sana for the second part of this show. And you tell us, how do doctors diagnose the causes or the underlying causes of headache?
Yes, so thank you once again, Qasim. So when a patient presents to a neurologist or a doctor with headache, the first thing the doctor does is take a thorough history from the patient. So this will involve getting the site of the headache, the onset, what is the character of this pain, is the pain radiating anywhere else or just limited to the head, is there any associated fevers, is there any associated seizures, is there any associated vomiting, for example, that comes with the headache. And then the doctor will also perform a thorough cranial system examination. So they'll do a thorough central nervous system examination. So most of the time, this history and physical examination is usually enough to come up with a diagnosis for the patient. But sometimes, if there is additional symptoms now, like fevers, if there is for example, the focal neurological deficits we discussed, if there is seizures, they might recommend additional tests. So this can include imaging, like CT scans and MRI, to identify if there is a lesion in the brain that is now causing this headache. They can also do something called a lumbar puncture. So it involves inserting a needle in the lower part of the spinal cord to drain something called cerebrospinal fluid. And then this is taken to the lab and the investigation is done, and then it's determined if there's a fever that was causing this headache. If patient has seizures, for example, they can do something called an EEG study. So what this test does is it analyzes the electrical activity of the brain, and it usually is a useful tool to diagnose seizures in patients that might be manifesting as headache as well. Yes.
Maybe you help us understand, because after diagnosis is treatment. What are the safest way of treating headache, most common headaches?
So the most common headaches are just the headaches of everyday life. So these are the headaches that, I just said, you go during your day from home, you are otherwise healthy, and maybe there's some dehydration during the day, fatigue, maybe you are stressed at work, and you develop a headache at the end of the day. So most of the time for those kind of headaches, non-pharmacological measures are usually first line. So you just educate the patient and tell them adequate rest, going to a quiet room, and just rehydrating, eating well, most of the time usually help to alleviate these headaches. So, but then let's say now you need some pharmacological intervention. So that means the usage of drugs. So we usually recommend that you avoid heavy painkillers, and you avoid like things like opioids, or most of the medication that's combination painkillers, like betapine, for example, usually a combination painkiller. So you just recommended to use simple analgesia like paracetamol. You can use acetaminophen, Panadol, yeah, just the simple things. Most of the time that works to alleviate your headache.
The pain, okay.
Yeah.
Maybe what are other types of heavy medicines or painkillers? Because we've already talked about the light one, Panadol, paracetamol, and what other painkiller did you mention?
The light ones, you have paracetamol, you have acetaminophen, you have Panadol, those. And then the heavy ones that are not routinely administered, you can only get them through prescription, is things like opioids. So you have the drugs like fentanyl, for example, and betapine also. Although in Kenya, most of the time, betapine is just usually an over-the-counter drug. But that shouldn't be the case, because the problem with these medications is they can cause addiction, and the patient needs to keep on using these medications to provide relief for the headaches, and so they are not routinely recommended. If first-line non-pharmacological measures are suitable, then that's usually more than enough to alleviate the headaches.
Maybe let's talk about the long-term prevention. Can headache be completely cured, or no, or just managed?
Yeah, so it depends on the cause of this headache. So like we said in the beginning of the show, you can have the primary headaches and you can have the secondary headaches. So most of the time, this secondary headache is usually a symptom of an underlying disease.
Okay.
So once you treat that disease that's causing this headache, you cure the headache.
Okay.
Yeah, but if the headache is a primary headache, so patient is a non-migraine headache patient, or patient is a non-tension headache or cluster headache patient, they require continuous management and follow-up.
Okay.
So the goal here for treatment is just to reduce the severity and incidence of attacks in these known patients with these primary headaches. Yes.
You talked about when someone is having a headache, it's advised to go to maybe a quiet or silent room.
Yeah.
For some people, when they're having a headache, they just sleep, and when they wake up, they are okay.
Yeah.
So should we say this headache, either it is as a result of fatigue, or it's as a result of stress, or it is a migraine, as you said, or what might be the cause, the main cause? Because he was having a headache, he didn't use painkiller.
Yeah.
After sleeping, he came out okay. What might be the main cause of this?
Yes, so those are now the headaches of everyday life.
Okay.
Yeah. So the headaches of everyday life are usually physiological causes is what causes this headache. So patient, as I said, otherwise well, and then they just go about their day, and they're tired from work, or they have fatigue, or they didn't sleep well the previous night, and they develop this headache. So most of the time, they just go back home, they take a shower, they go to bed, and they're fine.
Okay.
Yeah, but now some of the primary headaches, now for example a migraine, that one now some patients, because that one now they come in something called attacks.
Okay.
Yeah, they're not just there. There's some specific trigger. So a patient will report maybe they got a trigger somewhere and they developed an acute attack. Yeah, so these ones now they require medical intervention from a neurologist. So you see a neurologist and they'll prescribe drugs for you that are tailored to your specific needs.
Okay.
Yes.
Wengine tukisafiri, tukikosa kunywa chai, caffeine. Tukikosa tu kunywa chai, kichwa inatuuma. Tukisafiri kidogo, kichwa inatuuma. Ama kuna some of the people who use substances ambazo wakishazoea kuzitumia, inakuwa lazima atumie ndo akuwe sawa. Maybe you give us your final advice as we wind up the show, because time is really not on our side.
Yeah, so for I think the one you're mentioning, the caffeine and the substances, patients will develop headaches because of something called withdrawal. So it's typically seen in Ramadan, you know, once the patients start their fast. Before that, they've been consistently using coffee, for example.
Yes.
And then now all of a sudden, there's no coffee during the day. So they just present now with this caffeine withdrawal headaches. Yeah. So usually the advice that's given to them is just to lower the dose of caffeine that they take during the day, maybe switch to less caffeinated drinks, for example. Yeah, so in order to avoid these withdrawal headaches that come during periods like fasting, for example.
Okay.
Yeah.
You are parting short as we wind up. I'm
a firm believer in the adage that says prevention is better than cure. So it's good to have health-seeking behavior and habits, and to be health-oriented in order to prevent these chronic diseases and lifestyle diseases like now chronic headaches, diabetes, hypertension and all. Yes.
Thank you so much, Mustafa. The headache itself, we haven't talked about it. We just scratched few things, because we haven't talked about the diet, we haven't talked about nutrition, the role of nutrition. So I'll request you in our next episode, or when you find time, we talk about different types of headaches. Specifically, we can go with the migraines. We can go with the cluster. You did mention about cluster headaches and all that. So when we get time, we'll talk about it, inshallah, in our next episodes. And also, we can also talk about the role of nutrition, because for some of us, when we're having a serious headache, tunakula ndizi.
Yes.
Sasa hizo ndizi, what is the role of potassium in headache? So inshallah, because of time, I want to end it here. We meet in the next part, next show, same place, same time, only on Jamia TV. My name is Kasim Mustafa. Assalamu alaikum wa rahmatullahi wa barakatuh.